Welcome everybody to the next episode of Dr. Melissa Medicine Woman. Tonight we're going to be talking about sleep. So let me go ahead and get my presentation going here for you. So tonight we are talking about sleep. So I've titled this Z because we want to make sure we do get our Z's. And so I have a disclaimer because I am a medical professional. This show and all of its content are for educational purposes only and not intended to diagnose, treat, cure, or prevent any disease or psychological disorder. A specific physician or pharmacist-patient relationship is necessary before any medical therapies are initiated. Please consult your physician or your pharmacist or other qualified healthcare professional with questions about your medical conditions and before starting or using any dietary supplements, herbal remedies, exercise, or nutrition plans. So tonight we are going to talk about sleep. We're going to do an overview about sleep. We're going to talk about sleep and your health. We're going to talk about sleep hygiene. And we're going to talk about those medications and supplements for sleep, because you know that is part of my mantra as medicine woman. So who am I? Who is Dr. Melissa? I have 26 years of experience in both Eastern and Western medicine. I am a concierge consultant pharmacist, and I have over 52,000 clinical hours and counting. I do speak with hundreds of patients a week and amounting to thousands of patients a month, talking to them about their medications and their health. My clients call me the root cause doctor because I get to the root of the problem and take away those unnecessary medications and unnecessary supplements, which makes me a deprescriber. I'm also a wife of 20 years. I am an aunt, a sister, a daughter. I have a family here, and I'm actually, we have one more addition, so we need to take a new picture because I have a new niece. And so what is sleep? So when we talk about sleep, there's a couple of different cycles of sleep. And tonight we're going to talk about both REM and non-REM sleep. Now, during sleep, you do progress through 4 to 5 sleep cycles, and each sleep cycle is made up of 4 individual stages, and each stage takes between 70 and 120 minutes, so a little more than an hour up to 2 hours. The first sleep cycle of the night is mostly spent in non-REM sleep, and then the majority of your REM sleep happens during the second half of your night. Now, each of those 4 stages are broken down, like I say, into the REM and then non-REM sleep. So let's talk about non-REM. First, when we start to fall asleep, when we go from being awake to falling asleep, we have short episodes of kind of dozing off, transitioning into sleep. Now, that's our first phase. Now, the second, stage or phase, I will interchange those. The second is where we go into like light sleep, when our heart rate and our breathing starts to regulate, starts to drop, our body temperature drops. And then this slowly puts our body and our mind into that little settled into the sleep mode. It's very easy to be awoken from these first 2 stages of sleep, or first 2 phases of sleep. Now, the third stage is actually called deep sleep, and the body is put into recovery mode, and everything starts even slowing down even further. And then the 4th stage, that's actually when REM sets in. Now, REM is rapid eye movement, and that's because when you're sleeping in REM, you're also usually dreaming, and your eyes move rapidly as the action's happening through your system, whatever you're going through. Your brain waves are working a lot, almost like you're awake, but you're asleep. Now, your breathing increases, but your body becomes into like a paralyzed state when you dream, so that you're not actually acting out those dreams. So your body protects itself and puts itself in like a paralyzed state. That's exactly what happens. Okay. Now, when you sleep, why is sleep necessary? Sleep is necessary because your body resets itself. You have lots of processes that happen while you sleep. It allows your brain to reset. It allows your body to slow down. It allows recovery mode with both the physical activity that you put yourself through as well as the mental activity. Now, I did say earlier that your brain is active during REM sleep, but it does calm down during some of the non-REM because you need that break. You need that break to reset. Now, what happens is your brain adapts to what you've learned during the day, and it's called brain plasticity, which is your brain's ability to adapt to the input of what you put in, all the information that you've put in, all the memories that you've put in and stored through the day. That is happening at night. Your brain is going through that cycle. Now, if we don't sleep enough, then what we learned during the day isn't going to be able to be easily remembered. And that's why sometimes we're like, oh, it's right there, but you just don't get it because you can't grasp it because you didn't allow your brain to have enough sleep. Okay. Now there's some studies out there that say that also researchers believe that this is a time where your brain actually removes waste products and like from the brain cells, there's a waste product in there that doesn't need to be. It's like all the time your cells are regenerating, and so your brain cells are also regenerating. And so this is a time that the old goes out and the new comes in. So let's discuss more exactly what happens with your sleep. So sleep and your health. We're going to discuss the processes of what happens while you sleep. We're going to talk about some of the challenges of what happens while you sleep, such as weight gain, diabetes, heart problems. So when you do fall asleep, there are thousands of neurons in your brain that switch from being awake to being asleep, and that sends a signal to your body. And as that signal goes in, it reinforces your other systems. So like your cardiovascular system is affected, your immune system is affected, your metabolism is affected. Now, all of these along with some other processes. So as we start into that phase of non-REM sleep, your body slows down, like I said earlier. And then we go into your breathing starts to slow down. Your breathing actually reaches its lowest amount while you're asleep. Now that might be scary, but that's normal because your respiratory system needs to reset and it needs to calm down, along with your heart rate. Now your heart rate slows down as well. It slows to the lowest amount while you're asleep, especially in those non-REM sleeping phases. Now, when you're in the REM, of course, your heart rate might speed up because there's activity going on. Whatever you're dreaming about is happening, okay? So those are some things. Now, your muscles relax. And we talked about that you go into kind of a paralyzed state when you do go into REM, but the other time your muscles are just relaxed and you're just relaxed there, you stay put. Sometimes you might have restless leg that happens even while you sleep, but usually when you're in REM, your legs calm down. Okay, and we can talk about that more later. Now, also your brain waves show very clear patterns that they have slowed down, especially during non-REM sleep. Now, a REM, of course, they speed back up because that activity is going on. Now, in REM, your cognitive abilities, including memory and consolidation, happen when your brain waves are resetting. And then when you go back into REM, they become active. And then some of the things that happen during that REM sleep, then you cycle back and forth. And so you go back into another phase, and then you are going to remember those things that happened sometimes not. It just depends upon what part of your brain, your conscious or your unconscious brain, one of those is going to remember it. And sometimes that's why we do remember some of our dreams and why sometimes we don't. Okay. Now, in our body, we have what's called melatonin. Now, melatonin it's a hormone, and we do consider it it helps to set what's called our circadian rhythm, to help us be able to differentiate from light and dark and to know when to go to sleep. Now, melatonin is another substance, a supplement we're going to talk about later, but your body actually naturally produces melatonin. And sometimes when we don't produce enough, we don't always get sleepy. So that's something we'll talk about. Now, growth hormone is also produced at night. And this is through all stages of your life. Don't just think for children, because growth hormone supports your bones and your muscle development, as well as your metabolism. And this happens entirely throughout your life. Now, with our children, we might notice that they go to sleep and they wake up and they're a foot taller. That happens because, and it can happen because they're growing at night. Now, as we get older, it's more just the rejuvenation of our bones and our muscles, those cells rejuvenating, and then the metabolism, okay? Which metabolism is a huge thing. Now, cortisol, which is part of your body's stress response system. So at nighttime, your cortisol level drops, okay? And then it rises again because cortisol is necessary to help you wake up. And it keeps you active, and there's things that are protective about that. Now, if you don't get enough sleep, your cortisol level isn't balanced correctly, which that's what can lead to some weight gain, can actually put you at risk for diabetes and even heart problems. And we'll talk more in depth about that in just a minute. But your hormone levels, they fluctuate throughout your stages of your sleep. And so those are a few of the hormones that we talk about. Now, sleep is very vital. If you don't get enough sleep, it can put you at health risk, such as weight gain, like I talked about. It can also put you at risk for diabetes. There is actually a new study out there that showed that people who do not get enough sleep have a higher risk of both heart disease and type 2 diabetes. Now, that's some scary stuff, because if you're not getting enough sleep and you just put yourself at risk for heart disease and diabetes, so sleep is very, very, very important. So remember that. You want to make sure you get plenty of sleep. Other things that can happen if you're not getting enough sleep: depression. You can actually even have seizures, high blood pressure. If you have migraines, they might become worse. Immune system. Now, your immune system can become compromised. And if you want to know more about the immune system, be sure to check out my talk on that. Because what happens if you don't have an active or healthy immune system, you become more prone to infection. And sleep plays a huge part in that. You might notice that during we call it the cold and flu season, the winter season, because there's months where what happens is we're spending more time indoors, so there's more germs around and things like that. The flu virus lives longer in the warmer environment inside. So that's why it's more cold and flu. And if you're not getting enough sleep, you're putting yourself at risk to develop the flu, to get an illness, that kind of thing. So keep that in mind. Sleep is very, very important. And we talked about that it can hurt your heart. There's actually a new study that includes that not getting enough sleep, which means not more than, this study said not more than 9 hours of sleep. So you want to get between 7 and 8 hours of sleep every night for adults. Now, children need more sleep. They need between 9 to 14, depending upon what age they are. If they're younger, so toddlers and babies, they are needing between 14 to 20 hours of sleep sometimes, depending upon where they're at in their growth cycle. So keep that in mind. But a European study reported that those who are sleeping less than 9 hours, they said 9 hours, 9 hours of sleep a night, are getting negative effects and increasing their risk of coronary artery disease and having strokes. That is horrible. You don't want to have a stroke. Definitely don't want to have a stroke. They also reported in a breast cancer magazine that your risk of breast cancer goes up if you're not getting enough sleep. Now think about that. That's kind of scary too. When you're sleep deprived, it messes with your mind. You don't remember things. You sometimes become forgetful. You might fall asleep on the couch. You might fall asleep driving. Sleep is one of those things that your body regulates itself. And if you go for nights and nights without enough sleep, what's going to happen is that your body will tell you, I'm done. And it doesn't matter if you're behind a wheel. It doesn't matter if you're sitting on the couch. It doesn't matter if you're standing up. Your body will come to a point and it says, I'm shutting down, and you will fall asleep. And that is scary because you could be behind a wheel. You could be endangering your life or endangering somebody else's life. So take the time to get good quality sleep. The other thing that's affected when you don't get enough sleep is your sex drive. And that's something that we don't always think about, but that is important, that we make sure that we're getting plenty of sleep so that we have the right amount of the sex hormones being produced and we can be active. So what happens if you've got that stage old insomnia? I just can't sleep, so I'm not getting enough sleep. What in the world do I do? Well, we're going to talk about that right now. And with that, I've got some tips for you on sleep hygiene. And then we'll talk about some of the other things, those medications and supplements that might be beneficial in short term. But first, the most important thing is sleep hygiene. Regular bedtime. I know it sounds like I'm telling you as a child to go to sleep. It's important, no matter what age you are, to have a regular bedtime, because what happens is our bodies get used to that. It sets that circadian rhythm. It knows when to wake up. It knows when to go to sleep. So when we set and maintain a regular bedtime for ourselves, that's very important, and that's very helpful that we get plenty of sleep at night. And so during that regular bedtime, set it so that you plan to have a full 7 to 8 hours of sleep. Don't set the bedtime where then you have to be up in 3 hours or 4 hours. Set it so that you have a good window of 7 to 8 hours, of sleep, okay? Now, the next thing is a consistent wake time. Yeah, I know. Do you want to set the alarm? Maybe, maybe not. But if you could wake up consistently every day at the same time, you're getting 7 to 8 hours of sleep, your body's going to become used to that routine, and it's going to start waking up before your alarm even sometimes, because that helps the routine. Don't nap during the day as well. That just throws off the rhythm, okay? So go to bed at a certain time, allow plenty of time to sleep, and then wake up at a consistent time. Now let's go ahead, let's prepare the perfect sleep environment, because we want to make sure that when we sleep, everything is just right. So you want to make sure that you make your bedroom very inviting, conducive to sleep. It should be a place of comfort, relaxation. So ideally, the temperature, the cooler, usually we sleep better. Get rid of the TV, get rid of the computer, get rid of the cell phones. All of those ambient lights can keep you awake. And so ideally, you wouldn't have those in your room. You would have maybe a humidifier in there to have consistent moisture. Blackout curtains are very good. I have those in my bedroom that you can use so that if you're, if your sleep cycle, so you go to bed at midnight and you wake up at 8, well, the sun comes up before 8 o'clock. So I don't want to be woken up before 8 o'clock. So have those blackout curtains so that you can sleep during the time you need to sleep. Okay. Sometimes white noise is good. So you could have soft music in the background, from a CD player, or something besides a cell phone would be preferable. Maybe a noise machine is good to help, or a diffuser is also good because it acts as a humidifier. So that's also helpful to have in there. And that the things that you do before you go to bed, like your routine things like brushing your teeth, getting ready for bed, give yourself time, usually 30 minutes. Shut down the computer, turn off the TV, put away the cell phone. You can pick up a book to read or listen to a podcast or listen to some music, but don't do things that are really stimulating for your brain right before you're going to sleep. You can brush your teeth, wash your face, have that proper, night hygiene routine, but don't do anything really extravagant. Okay, now these are some suggestions and hopefully they are helpful for you and you can take one or some of them. The other thing is that sometimes the noise is affecting. So some people have to wear earplugs. They make certain specific earplugs that allow you to sleep. Sometimes eye masks are helpful and they make these eye masks. I saw these ones that they're not just flat anymore. They actually have like a point over your eye so that you don't feel it right there on your eye. And so sometimes a sleep mask is helpful. That's also helpful. And then how do you quiet your mind? I lay my head down and my mind starts racing. So how do I quiet my mind to promote good sleep? Well, what I do is you need to get rid of the anxiety and the worry. And so I tell myself, it's time to go to sleep. Put your head down. It's time to go to sleep. Whatever you're thinking about can wait till tomorrow. Now, if you are worried or have anxiety, I recommend that you get a notebook and journal. Sit down and journal and write down things that what you're going to do tomorrow morning, the things that are troubling you. We often will lay awake at night thinking about family, thinking about finances, thinking about our job or the future, because these are things that are all going through our head. They're bothering us. So take out a journal, a notebook, write down what you can do tomorrow, anything that you can control. Now then on a separate piece of paper or a separate page, write down the things that you cannot control, okay? And then let them go. That's huge. Let them go. And then tell yourself, it's time to go to sleep. I wrote down my worries. I wrote down what I can take care of tomorrow. Whatever's causing you stress, you can deal with in the morning. You can't do anything about it right now. So just lay your head back down after you write it all out. And then tomorrow you can go through the to-do list and figure out what you can do. And the things that you have no control over, let them go. And then your brain will quiet down and you can say, okay, I'm going to sleep now. So those are some things helpful for sleep hygiene. Now, the next thing I do want to talk about is medications. Now, I am not a huge advocate for medications or supplements unless you absolutely have to use them. Now, there are certain situations, sometimes when we're traveling, we need to use medications, or for short-term burst, we need to use a medication or a supplement to help us sleep. And so these are some of the most common ones. So I want to talk about 4 of them. They're similar, but I do want to talk about them because there's some things that you may not realize that if you are taking this medication, you might want to pay attention. Or if you're thinking about asking your physician for this medication or picking it up over the counter, let's talk about it. So one of them is Lunesta. Now, Lunesta is a controlled substance. And the thing with Lunesta is that you take the medication, and with most of these medications, you take the medication and you might engage in activities when you're not fully awake, not fully asleep, but then you don't remember what happened. You do things, it's kind of like sleepwalking. You do things and you don't remember what happened. I had a patient one time, it wasn't Lunesta, it was actually Ambien, but they took the Ambien, they told me, I told them to take it and go to bed. Take the pill, lay down. They told me later they didn't listen. They took it like 30 minutes before they were going to go to bed. They went to the bathroom. They actually fell asleep They hit their head on the bathroom counter. Thankfully, they were okay when they told me about it when I talked to them. But things can happen. They actually remembered that, but things can happen that could have been horrible. I mean, that could have been horrible. Hitting your head on a counter, falling down, that's not good. So if you do take these medications, or any of them, medications or supplements, you take it, you swallow it with plenty of water, and you lay yourself down, because you don't need to have an accident. Now, the thing with Lunesta is that if you have liver disease, breathing problems such as asthma or COPD, if you already have depression or you have an alcohol addiction, this medication is not good for you. Okay. And I know a lot of physicians who will prescribe this medication not knowing all of the other things that the patient is doing. They may not be truthful about what they drink or some of the other things. So be truthful with your physician, be truthful with me, contact me. We can go through things, because I don't want you to have any problems. Alcohol is a big no-no, not at any time with the medication. Okay. The other thing that can happen is there's side effects to medications. There's side effects to supplements. Now, with Lunesta, some of the most common things, it can cause headache. It can cause you to be sleepy. So if you don't have time to get a full 8 hours of sleep at night, you shouldn't take any of these medications or supplements to help you sleep. They're not going to be beneficial for you. It's what's going to happen is you're going to be groggy when you try and wake up, and it can lead to more serious problems. If you have, it could also cause side effect wise, it can also cause diarrhea, it can cause a headache, cause you to be dizzy. Those aren't fun side effects. And yes, it does interact with other medications and other supplements, especially if you're taking something else that slows down your central nervous system, or you're taking a medication that affects, you may have heard the cytochrome P450 or CYP3A4 inhibitors or substrates. These medications affect that, which most medications in some way or another have the ability to change that. Certain antibiotics are affected by Lunesta, and it's a controlled substance. So let's talk a little bit about Ambien. Now, Ambien and Prosom are both very similar, but we're going to talk about them anyway. So Ambien, which is one of my patients was on and fell down. Also, you can not remember things. You may not be fully awake. You could fall down, things like that. If at any time during the day you drink alcohol, 100%, you cannot take Ambien either. Okay. Now that's a huge thing. People don't realize that, because they think, oh, I'm going to have my glass of wine with dinner, and then I'm going to go and take my sleeping pill. Not a good combination. Not good at all. And these medications can be habit forming, which means you become dependent upon them. All of these that we're talking about for sleep, and even some of the supplements. And what happens then, if you try to go off of them abruptly, you can have really, really bad side effects. So if you are on one of these medications, don't just stop it. Let's have a conversation, because there's a way to safely get you off of the medication so that you don't have bad withdrawal symptoms, and we can get you to a good state. Now, of course, if you already have anxiety or depression, this is not a good medication for you either. If you have heart problems, not a good medication for you. Some of the side effects, very similar to the other one: dizziness, headache, lightheadedness. And of course, it interacts with a lot of medications. So you might want to make sure of what you're taking. Now, the last prescription medication here is the Prosom. And the Prosom, of course, also can have the effect, it can slow your breathing. It can make you where you don't remember things. Now, it has what we consider a black box warning. So a black box warning is a very big, bold thing that the FDA puts on certain medications when a lot of people have had bad experiences. Now, it doesn't mean that the drug is bad. It just means that a lot of people have had bad experiences. And that's because they've taken it with an opiate. So when you take an opiate, like a pain medication with the Prosom, there's really, really horrible effects that can happen. And so we don't want to do that. It's not a good idea for you to be on those two types of medications together. And if you are, let's talk about it, because we want to get you off of them safely. And then, of course, if you want to go off of that medication and you abruptly stop it, you can run into withdrawal symptoms, which can be worse. So side effect wise, as far as Prosom, you can be very sleepy, you can be dizzy, you can be confused. All of these medications, very similar side effect profile. Now there's one more I want to talk about, and that is Benadryl and ZQuil or diphenhydramine. Those are all the same, okay? I remember when ZQuil came out, they're like, oh, get your Z's. All it is Benadryl in a liquid and a pill form that NyQuil put out. It's diphenhydramine. So if you're those are the three same medication, great to help you sleep. I've recommended that. It's a good over-the-counter medication for short-term use. But just know that if you have asthma or COPD, or you have prostate issues, this medication may not be a good choice for you. Okay. And also, alcohol and this medication don't mix. So you kind of see a theme here. Alcohol and sleep medications, not a good idea. Benadryl, of course, can make you sleepy. It usually doesn't go to the extent where you don't remember things from happening, but it can make you sleepy, can give you a headache. It can make it harder for you to urinate, or it may make you urinate more, depending upon how much you're taking. It can also cause palpitations. And if you have high blood pressure, COPD, we already talked about, and asthma, not a great medication for you either. So that's my take on the sleep medications. Now there's more out there, but those are the ones I wanted to talk to you about today. Now, supplements. Now there's several supplements, but I picked 4 for us to talk about tonight. The first one is melatonin. We talked about melatonin earlier, that our bodies naturally produce this hormone. Well, what happened is that we knew that this hormone is good to help us sleep. So somebody went and decided to make it into a pill form so that we can take it and help us sleep. Because sometimes we're not producing enough melatonin. Now, melatonin in short amounts, okay for sleeping, just like some of the medications, short term. However, melatonin is one of those medications that if you have diabetes, you have depression, if you're taking a blood thinner like Coumadin or warfarin, it's not a good medication for you because serious other things can happen. Now, melatonin, a supplement. When we talk about supplements, we always want to make sure we're doing good quality supplements because you don't know what's in there. The Food and Drug Administration, the FDA, do not regulate the supplements. And so you want to make sure that you are getting a good quality supplement, but supplements do have side effects. It can cause you to be sleepy. It can cause you to have vivid dreams or even nightmares. Yes, too much melatonin or the wrong amount can cause nightmares. It can cause dizziness, confusion, and in children, it can actually cause bedwetting. So, some things to consider, because melatonin is often recommended for our little ones because it's considered safer. Now, it is safer, but it can have those side effects. It's not approved like the FDA, like I talked about. So always make sure that you're getting good quality supplementation. If you want to know what good quality supplementation is, then let's talk so we can make sure that you're taking something and you're not wasting your money. Now, valerian is another one you may have heard of. Valerian is good to help you sleep. It's been around for a long time, almost probably as long as melatonin or longer. The thing with valerian is that because of the way that it's sourced, if you have an allergy to certain flowers, you may not be able to take valerian. You might be allergic to it. And you can't take valerian with melatonin. You can't take valerian with chamomile. You can't take valerian with lavender. You can't take valerian with any of those prescription medications. And you can't take valerian with alcohol. Not a good idea. Valerian also has some side effects. It can cause dry mouth, upset stomach, and a headache. So it may not have the drowsiness or dizziness, but it's got some other things. But if you have asthma, if you have cancer, or if you have anxiety or depression, it's probably not a good medication for you. So the next medication I do, or next supplement, these are all drugs in my book because they're all made. So a supplement, the chamomile. Now we've heard of chamomile. We have chamomile tea, which is good to help you sleep. And that's why I wanted to make sure and bring this up, because when you're using the chamomile tea, now when it's in the food, you're usually not getting the effects. Sometimes you are, but usually not getting the effects of the sleepiness like you are when you're taking a chamomile capsule made purely of chamomile. The thing with chamomile is that you should not use it if you have breast cancer or ovarian cancer. Those are things you probably don't hear about. And once again, because of the way that it's made from a flower, that if you're allergic to certain pollens, you could be allergic to chamomile. Here's one you probably didn't realize. Chamomile interacts with birth control pills. Yep. There's a lot of medications and supplements that interact with birth control pills. So if you're of that age, pay attention, because we want to make sure there's a reason you're probably taking those pills. And if it's not working, you have a medication or a supplement that's inhibiting that the effect of what you want, that's something we need to talk about. Now, the side effect of chamomile is actually, it can cause a severe skin reaction, like red, itchy, blotchy, swelling skin. That's not good. Mild, it can cause a rash. And of course, if you have asthma, diabetes, we talked about cancer, not a good choice for you. So you're probably going, well, which one's a good choice for me? Well, we have to talk about that because each of you are unique, and there's all kinds of different things that happen with your body, with the food that you're eating, the medications that you're taking, the supplements that you're taking, the conditions, that we need to probably figure out what's the right one for you. One of these might be good, one of them might not be. This also interacts with warfarin or Coumadin, so keep that in mind. And the last one, the last supplement I want to talk about today is lavender. Now, lavender is a medication that it can be taken in certain, there is lavender that you can take orally. Now you got to be very cautious of the lavender that you take. Make sure it's a very good quality sourced one, because there's some toxic ones out there. Even when you're using lavender in a diffuser at night to kind of help calm you down, if you put lavender on your pillow, these are things that lavender is great for. Well, lavender can affect if you have high blood pressure or even low blood pressure, because it affects your blood pressure when you're taking the lavender. Not so much when you're just diffusing it. But if you're taking it internally, it can cause problems. It also has an effect if you're taking cholesterol medication. So that would be a reason that you may not want to take lavender. Now, lavender can have side effects such as a skin reaction. It can cause that rash to happen again. And it can cause constipation. That's not a good thing. And it can cause you to have an increased appetite. Then you think about that. You're trying to sleep. Maybe you're not getting enough sleep. You have weight gain, and now you have an increased appetite. So let's talk about that. If you think lavender is a good choice for you, let's chat and just make sure that it is the right choice for you, because it may or not be. So tonight we have talked about sleep, the REM and the non-REM sleep. We've talked about what the processes of sleep happen in your health. We've talked about good sleep hygiene. We've talked about the medications, several of the medications for sleep, and we've also talked about several of the supplements for sleep. So what is your next step? Well, this is one part of your whole body health system, your lifestyle medicine system. And so what I have for you is I have an offer for you. If you go to drmelissabalizan.com/WBH, whole body health, I have a program that includes some sleep information. It includes nutrition information. It includes lifestyle changes with anxiety, depression. It includes many different things as related to whole body health with your physical, mental, spiritual, and emotional health. And you get, as a bonus, a free 30-minute call with me. So that right there is your next step into being healthier, getting enough sleep, learning what you are, what you're doing as far as your sleep cycle. Okay. So that does give you all the information about sleep,